and welcome. My name is Kristen and I am your fabulous host here at Harnessing Healthcare. Here we share easy to understand tips and information to help you navigate your health insurance and get the most out of your health benefits. Today we'll be taking a closer look at one of my favorite topics, and that is all of the awesome freebies and discounts that are available to you through your health insurance plan. And these are very likely freebies and discounts you know nothing about already. So get excited. We are going to go down that rabbit hole today, and there is a lot of good stuff here. So even if you have not yet met your health insurance deductible for the year, you may still be eligible for a whole slew of free medical services, cool wellness perks, and even discounts on wellness related products. Not all health insurance plans offer wellness perks and product discounts, but all ACA compliant health plans cover the free medical services we will be discussing next. So there is something for everyone in this video, and I hope you're as excited as I am. But before I get started, I do want to define a term that I just stated, and that is ACA compliant. If you are not familiar with the meaning of that, ACA is short for Affordable Care Act. So if you have an ACA compliant health plan, it means that you have a health plan that is compliant with the Affordable Care Act. If you are not sure if you have an ACA compliant health plan, you can contact your plan administrator and ask them. It's that simple. If you are anything like me, free is your absolute favorite number. So if I seem a little too excited today to present this information to you, please forgive me. I just get excited sometimes. So without further ado, I'm going to go ahead and get started. I'm going to click on the web browser and I'm going to pull up Healthcare.gov. Okay, not .com, but .gov. And that's going to take us here to this website. I'm not looking, if we were, we'd go there, but we're not actually looking for coverage. So I'm just going to X out of that for now. This is a great resource and tool if you're not already familiar with it. It is a government-run website. I can't just go online and pick up a web address with .gov in it. You have to be a government entity. That keeps the integrity of such sites up quite a bit, which is great. So you can trust what you find on this website, that the information is accurate and fairly current as well. So if you have not explored this website, definitely encourage you to do that in the future. For the sake of this video though, we're going to start here at the search bar and I'm going to type in the word preventive. Okay, and click the word search. And there you have it. What we have here are the search results. These are just the first two that show. Because I want to be inclusive for the start of this particular presentation, I want to click Preventive Care Benefits because that will include the hyperlinks for all people, not just women in that last screen. So here you see a hyperlink for all adults, for women, and for children. Now, to get started, I'm actually going to start with women, ladies first and all. But I do want everyone else to pay attention to the beginning portion of that section, just simply because there's information that pertains to all people there. So I will go ahead and click on that for women section. You will notice this is basically this section is what I want everyone to listen to. And I'm going to read it verbatim and then translate because not all things are very easily understood in the terminology that's used on sites like this. So for starters, all marketplace health plans and many other plans must cover the following list of preventive services for women without charging a copayment or coinsurance. This is true even if you haven't yet met your deductible. So loosely translated, that basically means you are not paying a copay or coinsurance or a deductible, which means that these preventive services I'm going to go through are completely free. Okay, now I'm going to read the next section here, and that says these services are free only when delivered by a doctor or other provider in your plan's network. What this is loosely translated to is that you must use an in-network clinician or a doctor, a physician assistant, a nurse practitioner to provide these preventive services in order for them to be covered. You cannot go to an out-of-network doctor and still have this covered as preventive care. So keep that in mind as well. These are all really key points, but I'm going to add an additional piece you do not see on this website, and that is when you go to make an appointment for any of these services, you're going to want to make sure that you, when you schedule the appointment, let them know this is a preventive care visit, and you want to make sure that it is coded and billed as preventive. Then when you show up for your appointment, I want you to reiterate that to the front desk staff to make sure that it is coded and billed as preventive care. Okay? And then another thing to keep in mind as well is sometimes we know there's something wrong. Okay? If you find a lump, you're like, okay, there's something wrong. So going to a preventive care visit when there is something like that going on, what will end up happening is when you start discussing that lump or the doctor finds a lump, they will then change that visit to a diagnostic type of visit, and it will not be covered as preventive. So if you do have a concern that you want to see a doctor for, don't try to figure out how to get it seen under here because it's going to work against you anyways. So I would just make an appointment with your healthcare professional and take it from there. So without further ado, if you were a man that was listening into the section for this little bit of information, you can kind of check out. I'm going to try and do timestamps for this video because I have a feeling it might be a little long and certain sections only pertain to certain people. So without further ado, we'll go ahead and get started, and just know that, again, we're in this section for free services for women. And this first section is going to be services for pregnant women or women who may become pregnant. But I'm actually going to start at the bottom section first because I think it's a little more general and applies to a lot more people. I don't want to just sit and read off everything. I just want you to notice all of the hyperlinked services here, and then also the additional information you see after it, because that applies as well. Now, some things you may need a little more information on. For example, breast cancer genetic test counseling. You've all probably maybe heard of the BRCA gene. This would be something that is covered for women at higher risk. What does that mean? Good question. That is who you would, the people that would pertain to. You'd want to talk to your healthcare professional to see if you actually fall in line with that. Others are a little bit more cut and dry. For example, osteoporosis screenings for women over age 60, depending on risk factors. I guess that's not super clear because there's that. How about this one? For sexually active women, if you are a sexually active woman, you can get HIV screening and counseling. Boom. Nice and easy, okay? So we have all of these services. I want you to kind of look through cervical cancer screenings, breast cancer chemo prevention counseling, mammograms, genetic test counseling, specifically for the breast cancer gene BRCA, sexually transmitted infection disease screenings, RH incompatibility screening, syphilis screening. I mean, there's so much info in here. I mean, to read through it could be a little overwhelming. I do want to point out this one here. That's the Well Woman visits. So basically your annual Well Woman visit is completely free as long as it's preventive. So to get recommended services for this, you would need to be under 65. And you're probably like, well, what happens when you hit 65? Well, you end up in Medicare. So at that point, you're in a completely different insurance product. And so that actually wouldn't apply. And that's why it states that. So this is really a great, great resource. And it's worth kind of clicking around, seeing what you may actually want to look for yourself. And these would be free services, again, as long as when you're booking the services, you tell them that they're preventive care services that are provided and you have an ACA-compliant plan. If you have questions about that, you can definitely talk to your insurance provider a little bit more. I'm going to actually, it just says healthcare.gov, but there is an actual link here that I'm going to put into the description box below at the end of this video. So don't worry about needing to know exactly how I got to this page. I'm going to give you the exact link and you'll be able to find that on your own later. I also want to take you to another section that is pretty important for women, and that is covered contraceptive methods. So FDA approved contraceptive methods prescribed by a woman's doctor are covered. And that includes all of these that you see below here, including emergency contraception like Plan B, and I'm not sure how you say it, if it's Ella or Ella, like the Spanish pronunciation, not really sure. Sterilization procedures, patient education, and counseling. There's a lot of information here, so it's best to kind of ask a little bit more if you're not sure. But I really want to take you a little bit further here because there is a section that outlines when you are not going to qualify for these benefits, and that is if you work for a religious employer or for a nonprofit religious organization. So they have an option to opt out of, basically they're exempt from offering contraceptive services, and so in that case you may have to pay for them out of pocket. So those are things you may want to kind of investigate on your own. You may want to contact either your HR administrator, your benefits administrator, and just find out, are you a religious employer and have some sort of a religious exemption. So if you're not sure, definitely ask. My big thing is trust but verify all the time. So we're going to go back because that was a lot of information. Now, keep in mind also that this is going to be a tier 1, maybe like your generic type products and things like that, if anything. So birth control pills, vaginal rings, things like that. So if there's a brand new product on the market you're really excited to check out, it might actually be on a tier 3 for prescriptions, and that's something worth looking into if you're not sure. But if in doubt, you let your doctor or healthcare professional know that you are going to be receiving these as part of your preventive care, and so you need it to be, either generic or at least compliant to that program. Your pharmacist may be able to help you out with that information as well. All right, so I'm going to go back to the original page for women. And again, we kind of covered the basics for women in general, but I want to go up to the top section again for services for pregnant women or women who may become pregnant. So who are women that may become pregnant? They're basically women of childbearing years that could conceivably become pregnant. So whether they are choosing to become pregnant or just can, that kind of falls in line there. So all of these services here, from anemia screenings, breastfeeding counseling and support, contraception, folic acid supplements. I thought that was kind of cool because folic acid is really good for everyone. And to my knowledge, I'm not a mother and I'm not looking to get pregnant, so I don't actually research that side of things. But to my understanding, folic acid is a supplement you should be taking in advance of trying to get pregnant. So it makes sense to be taking folic acid, and most women specifically, don't get enough in their diet. So this is kind of cool that a lot of you will be getting folic acid supplements, and that is a really, really neat benefit. So we have gestational diabetes screenings, obviously sexually transmitted disease screenings, preeclampsia. If you've never known anyone who had high blood pressure when they're pregnant, there's a lot of risk to the mother and the child. And so there is screening and prevention available for that. I believe it's nutrition related, but I'm not 100% sure. Don't quote me on that. I'm not a healthcare professional. RH incompatibility screening. So this is really, really important as well for any woman that is or may become pregnant. Tobacco intervention and counseling. Obviously, we know smoking while pregnant, not a good thing. Urinary tract or other infection screening. Again, very, very important when you are pregnant or looking to conceive. So now going back to the main page where it showed all of those hyperlinks for everyone, I'm going to now go to adults, okay? And that's for all adults, male or female. And if you were wondering why there is a separate designation, why there's like for women and then it's for adults, which also includes women, women just have some obvious specific needs that are very different from men. And so that was what was being paid attention to with that separate hyperlink. So again, the same things apply to kind of that section that we went to before, where we talked about no cost for these services, you must stay in network, and again, my added comment about making sure that you um, tell your healthcare provider when you're scheduling that it is a preventive care service and you want it coded and billed as such. And then when you show up for your appointment, letting them know the same as well. So that was just kind of a quick rehash there. I want you to kind of like breeze through visually, kind of look at this screen while I'm still talking because I'm not going to read everything verbatim. It would just be super boring. But there's some really interesting stuff that you'll see kind of covered in here. For example, a one-time screening for an abdominal aortic aneurysm for men of specified ages who have ever smoked. Okay. One-time screening, but like that could be a lifesaver for someone. That really could be. Alcohol abuse screening and counseling. There's information for aspirin use. And I believe, I'm not exactly sure the specifics. I don't know if they provide the aspirin for prevention. That would be something you might want to discuss with your healthcare provider or your insurance company to get more clarification on that. Blood pressure screenings, colorectal cancer screenings, diet counseling, fall prevention. Again, we got sexually transmitted infection, disease screenings. You have all these immunizations here. Okay, so I'm going to kind of take a little sidebar here and say that whether you feel good about immunizations for you or your family or you don't, I would not like for this to turn into a debate about that. If it's not of interest for you, just keep scrolling on and focus on the things that best help you. But these things are in place because there are individuals that do want this type of service. So we got to make sure that they understand that that's available to them as well. So I want to be fair to everyone, and I'm not advocating one way or another. I believe everyone has the right to choose how to care for themselves the best. So as you can see here, all the immunizations and vaccines that are available, which there are very, very many, okay? Lung cancer screening, obesity screening, tobacco use screenings. I mean, there's so much in here, guys. I could really just talk about it ad nauseum and you guys would be bored to tears, except for the fact that this is all free preventive care through the Affordable Care Act, and it's super awesome. So I bet right now you're thinking, whoa, I thought my insurance didn't do anything. Well, at minimum, you're going to have all of this at your disposal from here on out, which is pretty exciting. So I'm going to go back to that original page again that had the adults, women, and children hyperlinked, and we're going to go to the children section this time. So if you have a family, obviously this is going to appeal more to you because you will have dependents possibly on your plan as well. There is information for all of the children's preventive health services, and those are noted here. You're going to see a lot that were not in the adult preventive services, so definitely worth reviewing it. There may also be some age designations as to how that works and how it can be used. So I'm not even going to really read through the specifics here, but you can see a lot. Depression screening. They have a lot of even behavioral stuff, autism screening. Um, Believe it or not, we have some fluoride stuff, which I say believe it or not just simply because it seems more dental in nature. But they do provide, it looks like, fluoride supplements and varnish and whatnot. Again, that's probably another controversial topic. I'm not advocating for or against. I'm just stating what is on the Healthcare.gov website. You obviously have to make the personal decisions for yourself and for your family. Aside from that, we have hearing screenings, height and weight, body mass index, hyperthyroidism screenings. Again, immunizations. Again, if you want them for your children or you don't, neither here nor there. Just know that these are available for your family if you do so choose, and they will be free and fall under that preventive care. Iron supplements. Gosh, I mean, I'd say there's more for children than any other age group out there. But even interestingly, there is a vision screening here. I saw vision screening, hearing screenings. I think there was even nutritional screenings. There's a lot available to this age group. So, especially if you are a parent and you have any dependents on your health insurance plan, it may be worth perusing this a little bit more. So, like the women link, the contraceptive link, the adults link, and now the children link. I'm going to link all of this again down below in the description box for you guys to access very easily. So don't panic that you don't know exactly what this link is. You're going to have access to it. No problem. So from here, I'm actually going to take you to a little page that I put together for you guys. I did it just for you. You should feel really, really special. And this is actually kind of gearing away. So the Healthcare.gov, I'm going to go back here. Healthcare.gov, these are all preventive care services, medical services, immunizations, etc., that are offered through the Affordable Care Act. Okay? They're provided there. Now, what I'm going to show you next is actually potentially, not guaranteed, but potentially offered through your insurance plan, and just letting you know about all of the things that are out there. So, for example, some insurance companies offer discounts on your insurance for using wearable technology. I actually knew someone that this was the case, and they were given a free Fitbit that they had to wear 24/7. And in order, it like kind of the trade off was they got a discount on their insurance premiums. And I remember thinking how interesting that was. One of the watch outs for this type of program might be that it includes an enormous amount of data that you then make available to your insurance company. So that's neither here nor there. Just, everyone has differing opinions on that. I think at this point we don't exactly know what they're using that information for. So if they could provide a statement stating how they'll use that information, maybe that would make you feel a little better. But I'm not sure if they have to. But if you do have a program like that, it may help you offset costs of premiums or just provide wearable technology like Fitbits at a discounted rate. So a side benefit to wearing something like a Fitbit is that your doctor, if they're set up to do so, can actually track your your health data automatically. So that could be really cool, especially if they need to constantly track maybe how well you're sleeping, if you're getting up a lot during the night, your heart rate, your activity level. There's a lot of things that actually could potentially help your doctor get a more clear picture of your health, especially if they're tracking a particular disease and managing that. So your insurance provider may offer a type of wellness debit card or an allowance that's put into your paycheck or various other wellness benefits. And again, I don't want to just sit and read off all of them. This may be something I'll probably post on the harnessinghealthcare.com website so you can kind of have that at your fingertips. It's one of those things that more or less I'm just wanting you to be aware of. You don't necessarily have access to all of these, but if you know, you can kind of give examples to your employer if they're asking for ideas of wellness type services that you'd like to see added to your either insurance plan or even potentially benefit programs outside of your health insurance. So this again can be covered by your own insurance program or plan, sorry. So anything from fitness centers, gym memberships, diet and weight management programs like Weight Watchers and Nutrisystem, nutritional supplements and discounts from retailers of nutritional supplements, discounts on skincare or yoga equipment or free yoga classes, or discounts or free races and fun walks and the registration related to that, various sports programs, smoking cessation benefits. There's also typically a free, I'm going to say typically, but I've seen it quite a bit, so I'm going to say typically. But there's typically a free nurse phone line that you can contact to reduce the need for unnecessary doctor visits. And that can be really helpful for really busy individuals or people that have, I don't know, a couple of kids in tow that it's a lot to just go trekking out to a doctor for every sniffle. they would basically triage you, typically free of charge, and let you know if it's even worth going to the doctor. Now, another benefit you see a lot more these days, and I think this is the direction of healthcare, is free or discounted telemed services. If you're not familiar with telemed, it's basically, again, instead of it just being a phone line, it's like phone and video, kind of like a Skype session, if you will. And they're usually done through apps, and they may offer free or discounted services. And you're basically talking to either um, a doctor, a nurse practitioner, a physician assistant, and they can handle your more general concerns like a sore throat, maybe an ear infection, things like that, that don't necessarily require an in office visit. Of course, if something does require an in office visit or diagnostics further, they're going to recommend that you go in to see a doctor, of course. So, another interesting perk that I've actually had at one of my employers was a health risk assessment. It's basically like a 10 or 20-minute questionnaire about my habits. And I filled it out and I got $100. And I thought that was kind of cool. But then I also had a coworker who said she never does it. And I was like, oh, why is that? And she's like, I don't want them having that much information about me. I don't know how they're going to use it. And I thought that was, very commendable. So you, again, like all these other things, you really kind of have to assess the risk and whether it's worth it for you or not. But in a lot of cases, they may incentivize you to complete these health risk assessments. So they're worth looking into. And then kind of like the various benefits associated with women and well care on Healthcare.gov. There's also typically a lot of maternity benefits through your insurance plans. So that could be health coaches, what to eat, what not to eat during pregnancy, birthing classes. In some cases, I've even heard of pregnancy journals and information charts, tools, etc. So again, this is not a one size fits all that your insurance plan covers all this. Chances are it doesn't. But one thing that you can definitely do is contact your insurance and say, hey, I'd like to know more about any wellness programs that you provide as part of my insurance plan. One other thing I don't think I actually went over was, in relation to these wellness debit cards or allowances, I just helped someone the other day that had a program like that. And basically, they received points for doing healthy activities. So every time they did healthy activities, I think they log on to their portal, they say they did it, they got points. They could then use those points for up to $200 that would be put into their paycheck, or they could use it for gift cards. So sometimes there's even cool little programs like that as well. And sometimes they involve a little more than healthy activities, and maybe it's going for your annual exam, etc. Now it's a prevention is worth a pound of cure. So I love when there's more and more of a focus on wellness. So obviously, this is not an exhaustive list of all of the amazing freebies and discounts that may be eligible. That you may be eligible for. So please comment below and share any other cool benefits you have received or which ones you are most excited to look into for yourself. The best way to find out what freebies and discounts you qualify for is to A, download your health plan's app, B, review your health plan's website, or C, ask your insurance representative by phone to send you more info on wellness programs and discounts offered through your plan. So if you are not sure whether your company has, that was something else. So keep in mind that many employers, large and small, offer attractive benefits and work perks similar to or possibly even better than the ones I've mentioned in this video and on this last Word document here. A 2017 study reported by the Kaiser Family Foundation revealed that 85% of large employers that offer health insurance also offer wellness benefits. So what that means is you may have wellness benefits that are similar to what you have here, but they're not actually through your health insurance. Your employer offers them. And I've seen some really cool perks and benefits over time. So it's definitely worth asking about. I have actually worked where I had like an intranet kind of employee portal, And I just kept clicking around and going through it and just really studying the benefits that were available to me because there were many, especially when you work with a large company. If you enjoyed this video and would like to learn more about these benefit programs that I'm talking about separately, comment below and let me know, and I'd be happy to explore those a little bit further in a different video. Please like and subscribe to our channel and receive alerts to be the first to know when we post new videos. To join the conversation, check out harnessinghealthcare.com, a site where you can learn, contribute, and download free lists of questions you can ask of your insurance provider to better understand your insurance coverage. You can also find community support for your specific situation on our Harnessing Healthcare Facebook page and on Instagram at harnessing_healthcare. All links from today's video are noted in the description box below. Till next time, stay strong and harness on.